2 years ago, you had cataract surgery. Vision was perfect. You read menus without glasses for the first time in 20 years. You drove at night without flinching at oncoming headlights. For about 18 months, you forgot the surgery had even happened. And now, somewhere between 16 and 30 months out, everything is getting cloudy again. Headlights are haloing. Reading is harder than it was 6 months ago. The morning light through your window looks softer, foggier than it used to. And your first thought is the thought every cataract patient has at exactly this point. Did the cataract come back? I want to be straight with you. It did not, and anatomically, it cannot. The lens that was clouded was removed during surgery, and a clear plastic lens was put in its place. The cataract is gone for good. But something else has happened, something that affects roughly 30 to 50% of cataract patients within 5 years of surgery, and something most surgeons never warn you about. In the next few minutes, I'm going to walk you through exactly what's happening inside your eye right now, a condition called posterior capsule opacification, or PCO for short, sometimes called a secondary cataract, though that name is misleading because it isn't a cataract at all. I'll cover the anatomy so you understand exactly what's clouding over, the actual mechanism, why this happens, and why it has nothing to do with your original cataract returning. The 4 assumptions almost every patient walks in with, and why each one is wrong. The 5-minute in-office laser procedure that fixes this permanently. The one situation where your ophthalmologist will actually tell you to wait. And the rare risk you should know about, even though it almost never happens. I'm Dr. Karen Holm, your senior vision wellness educator, and I've spent years helping people understand what's actually happening behind the words their surgeons use. Before I go further, I want to draw a clear line. There are vision symptoms that mean stop watching this video and call your ophthalmologist today, not next month. Sudden vision loss in one eye over hours or a single day. That's an emergency. A dark curtain or shadow crossing your vision, especially combined with flashes of light, that's an emergency. And it matters more after cataract surgery because the surgery slightly raises your lifetime risk of retinal detachment. Sudden, severe eye pain combined with nausea, that's an emergency too, possibly angle closure glaucoma. If any of those describe you, stop this video and call your eye doctor today. Posterior capsule opacification doesn't present that way. It's gradual, painless, and shows up as slow fogging, new halos around headlights, and reading that's gotten harder than it was right after your surgery. If that's your pattern, stay with me. This video is for you. Let me give you the anatomy because none of this makes sense without it. Inside your eye, behind your iris, your natural lens used to sit inside a structure called the capsular bag, a thin, transparent envelope, almost like a soft cellophane wrapper around the lens, with a front wall and a back wall that meet at the edges. During cataract surgery, your surgeon opens the front wall of that bag, removes the clouded lens through the opening, and places your new artificial lens inside the bag. The back wall, the posterior capsule, is deliberately left intact. It's what holds your new lens in position and keeps the inside of your eye stable. And that back wall, that thin, clear membrane just behind your artificial lens, is what slowly loses its transparency over time. Light passing through it starts to scatter instead of focusing cleanly on your retina. And that's exactly what produces the fogginess, the halos, and the reduced contrast you're noticing. So why does the back wall of the bag go cloudy in the first place? During your original surgery, your surgeon removes most of the lens material, but a small number of cells called lens epithelial cells remain attached to the inside of the capsular bag. These are completely normal cells, not abnormal, not dangerous, not a sign anything went wrong. They're the same cells that originally built your natural lens, and they're biologically programmed to do one thing: grow. Over the months and years after surgery, those remaining cells slowly migrate from the edges of the bag toward the center of the back wall. As they move, they multiply, and they lay down their own protein that isn't perfectly transparent the way the original capsule was. It scatters light, it accumulates, and over 6 months to 5 years, depending on the patient, it builds up enough to start affecting your vision. This isn't something you caused. It's not about your eye drops, your sleep, or anything you did or didn't do. It's just normal cell biology happening in a place surgeons can't fully clear during the original operation. Here are the 4 assumptions almost every patient walks in with, and each one is wrong. Assumption 1, the cataract has come back. No, the cataract was removed and anatomically cannot return. What's clouded is a completely different structure. the back wall of the capsular bag, not a lens. Assumption 2, I need another full cataract surgery. No, the fix isn't a surgery at all. There's no incision, no recovery time, no anesthesia. It's a laser procedure done while you sit in a chair, takes about 5 minutes, and you walk out the same day. Assumption 3, if I wait, it'll go away on its own. It won't. This is a one-way process. The cells keep migrating, the protein keeps building up, and waiting only lets the fog get worse. Assumption 4, once I get the laser, it might happen again. This one's actually the most reassuring to correct. Once the laser opens a small clear window through the cloudy back wall, that window stays open permanently. The cells can't reclose it. You're done with this problem for life. Now I want you to pause and do an actual self-test. This will tell you whether posterior capsule opacification is the dominant issue in your vision right now. You'll need a high contrast object across the room. A black book title at about 10 feet works well. Stand in normal indoor light, cover one eye with your hand, look at the title, and rate the sharpness from 1 to 10. Then switch hands and cover the other eye and rate the same title again. If the eye that had surgery is now rating 2 points or more lower than the other eye, and that difference wasn't there in the months right after your surgery, that's a strong PCO signal. If both eyes rate equally low, the problem might be PCO in both eyes, or it could be something else entirely. Either way, the next step is the same. Call your ophthalmologist's office and ask specifically to be evaluated for posterior capsule opacification. Let's talk about the procedure itself. It's called YAG laser capsulotomy. YAG stands for yttrium, aluminum, and garnet, the crystals used in the laser, though you don't need to remember that. What matters is that this laser has been the standard PCO treatment for nearly 40 years. Here's how it goes, start to finish. You arrive at the office, they put dilation drops in the affected eye, sometimes a numbing drop too, and you wait about 30 minutes for your pupil to dilate. Then you sit at a machine that looks like the slit lamp you've already seen at every eye exam. Rest your chin on the rest, and the doctor places a small contact lens on your eye to keep it focused. There's no pain, just a sensation of pressure. The doctor fires the laser through the cloudy back wall, making a small, clear, circular opening directly behind your artificial lens. The whole laser part takes 3 to 5 minutes. Total time in the office, including check-in and a post-procedure pressure check, is about 90 minutes. Most people see meaningful clarity within hours and full clarity within a day or two. Now, the rare risk most patients aren't told about. After YAG laser capsulotomy, some patients get a small temporary spike in eye pressure. That's exactly why your ophthalmologist checks your eye pressure about an hour after the procedure before letting you leave. If it's elevated, they'll give you a pressure-lowering drop, and it resolves within hours. The more serious, though still rare risk, is retinal detachment. Cataract surgery itself slightly raises your lifetime retinal detachment risk, and YAG laser capsulotomy adds a small additional increment on top of that. The absolute risk is still low, somewhere between 0.5% and 2%, depending on your baseline factors. It's higher if you're extremely nearsighted, if you've had a retinal detachment in your other eye, or if you have a family history of it. Mention any of those to your ophthalmologist before scheduling. And there's one specific situation where I'd tell a patient to wait. If you have active macular swelling or active inflammation in the eye, those need to be treated first, because the YAG can temporarily make them worse. Let me tell you about Margaret, a composite, illustrative patient, but her pattern matches what we see routinely in post-cataract follow-up. Margaret is 71. She had cataract surgery on her right eye at 69 and her left eye 6 weeks later. For about 18 months, her vision was the best it had been since her 30s. She put away her reading glasses, drove at night without a second thought, and told her family the surgery was the best decision she'd made in her 60s. About 22 months after her right eye surgery, she noticed it slowly fogging. The bedside clock at night was harder to read. The streetlight outside had a soft halo. She covered her left eye, looked at her television, and the picture was clearly less sharp. Her first thought was that the cataract had come back. When she came in, the diagnosis took less than 2 minutes at the slit lamp. Clear PCO in the right eye, early signs in the left. Her surgeon scheduled YAG laser for both eyes a week apart. Within 48 hours of the first laser, the fog was gone. Within 10 days, both eyes were sharper than they'd been in a year. There are 3 habits that quietly delay a PCO diagnosis, even after symptoms have clearly started. The first is assuming the fog is just part of normal aging. It's not. Cataract surgery should hold your post-op vision quality for many years. So if your vision is meaningfully declining 1 to 4 years after surgery, the most common explanation is PCO, and the fix is the YAG laser. The second is waiting for your next routine annual eye exam. PCO doesn't need to wait for that. Call your ophthalmologist's office, describe your symptoms specifically, and ask for an evaluation. Most offices can fit you in within a few weeks at most. The third is going to an optometrist for a new glasses prescription. New glasses won't fix PCO because the problem isn't focus, it's light scattering through a cloudy capsule. A new prescription might sharpen the eye chart for about a week, but the underlying fog will keep getting worse underneath it. Here's the action protocol. Start it today. Step 1. Do the covered eye self-test I described earlier. Step 2. Call your ophthalmologist's office or whoever's currently managing your eye care and use this exact phrase. I would like to be evaluated for posterior capsule opacification. Step 3. At your appointment, ask 3 questions. Is the diagnosis PCO? Am I a candidate for YAG laser capsulotomy? And are there any reasons specific to my eyes, high myopia, prior retinal issues, active macular swelling, I should know about before scheduling? Step 4. If the YAG is appropriate, schedule it. The procedure is brief and recovery is essentially nothing. Step 5. After the YAG, return to your normal routine. There are no long-term restrictions, and the fix is permanent. If you've been quietly living with post-cataract fog for months, this is the resolution. It exists, it's simple, and it's in office. So to recap, in case you came in late, the fog that returns 1 to 5 years after cataract surgery is not the cataract coming back. It's posterior capsule opacification, cloudiness of the back wall of the capsular bag, and it affects 30 to 50% of cataract patients. The fix is YAG laser capsulotomy. 5 minutes at the laser, about 90 minutes total in the office, no incision, no recovery, and a permanent result. The one situation to wait is if you have active macular swelling or inflammation that needs treating first. When you call your ophthalmologist's office, use the exact phrase, posterior capsule opacification. It moves the conversation past the brochure language. Make that call this week. And if you know someone whose vision has been quietly fogging months or years after their own cataract surgery, send them this video. They've almost certainly been carrying the same fear Margaret carried, with no idea the fix is one laser appointment away.